Case 40. An 18-year-old college freshman is brought to the University Health Center by his dormitory roommate. The patient complains of 2 days of fever, several episodes of vomiting, and joint and muscle pain. His temperature is 38.9 degrees centigrade or 102 degrees Fahrenheit. Physical examination reveals a petechial rash on the lower extremities, photophobia, both Koenig and Brudzinski signs are positive. What is the most likely diagnosis? This patient likely has Neisseria Meningitidis, meningitis, a gram-negative, kidney-shaped diplococci infection. What test can confirm the diagnosis? Culture of meningococcus from cerebrospinal fluid, CSF or blood. Lumbar puncture shows an elevated WC count with mainly polymorphonuclear cells, decreased glucose levels, and normal to high protein levels. Bacteria are visible on gram stain. This pathogen can also be cultured on Thayer Martin media, which is chocolate agar with antibiotics to kill competing bacteria. And Neisseria meningitidis is oxidase positive and ferments both maltose and glucose. What are Koenig and Brudzinski signs? Koenig sign is considered positive when a patient resists straightening of the knee joint while the hip is flexed. Brudzinski sign is considered positive when the patient, while supine, lifts his legs when the neck is flexed by the examiner. Neither test is very sensitive, but a positive result is suggestive of meningeal irritation either by blood or inflammation. What are the most important virulence factors and toxins of this microorganism? Neisseria meningitidis has thin protrusions called pili that help it attach to nasopharyngeal epithelial cells. Once attached to the nasopharynx, the pathogen secretes IgA protease to neutralize the predominant antibody idiotype found on mucous membranes. Neisseria meningitidis also features a capsule that protects it from other host defenses such as complement and phagocytosis. As with all gram-negative bacteria, Neisseria meningitidis has a lipopolysaccharide, or LPS, a potent endotoxin in its cell wall. What is the appropriate treatment for this condition? Intravenous penicillin G or ceftriaxone must be administered immediately. Bacterial meningitis can be fatal within hours, so empiric antimicrobial treatment must be started before culture results or other confirmatory tests are available. Rifampin is recommended as prophylactic treatment for contacts of the patient, especially if they are immunocompromised or have not been vaccinated.